What's up, everyone? Welcome back to my channel. Today I am with my doctor, my dermatologist, Dr. Kirby.
Nice to see you.
Hi.
How many years have I known you?
I think like 7 or 8.
It's been a long time.
No,
Jeffree Star, one of my favorite patients, so I'm honored to be here.
Yes, we met a long time ago because I had a thick beard, and back in the day it was ruining my makeup. So I first came for hair removal. The beard's gone, then we went to tattoos. Tattoos gone, redone, and now we're back for the lips. Now, you guys know I'm all about changing your appearance. If you want to do it, don't do it for anyone else but yourself. And we've been doing lip injections for like 6 years? Yeah.
It's been a while.
Yeah. Now, people think that they're permanent. So let's break down a few myths.
I'm glad you brought that up. So when we talk about lip augmentation, at one end of the spectrum are things that are very, very temporary.
Yeah.
My favorite substance to use is old-fashioned collagen.
Yeah.
And it's really soft, it's really kissable, it's really smooth. The only problem is it lasts about 6 weeks.
Yes.
The other end of the spectrum are permanent fillers. Silicone, there's other branded permanent fillers, and I don't recommend those because even if you love it at the time, your face is going to change over time.
Yeah.
And then you're going to be stuck with that because, as the name suggests, they're permanent.
Yes.
So
you don't want that.
You don't want that. So very temporary, very permanent. What do we find ourselves? A happy place in the middle. So that's hyaluronic acid-based fillers. Juvederm, Bolotero, and Restylane are the most common.
And we're doing Juvederm today. And the last time I did it was like a year ago. So my lips are getting smaller and they're ready for a revision. So I'm noticing the bottom's gotten smaller and then the top's just getting, see how it's really small in there.
When we look at lips, one of the most important things is symmetry. And your lips are very symmetrical, which is great.
Thank God.
We also want twice the volume in the lower lip as in the upper lip. One of the biggest mistakes that occurs during lip augmentation is...
People do the top too much.
Thank you.
And
That's
then the bottom
correct.
looks smaller and then the top's so crazy and I'm like, whoa, slow it down.
100% correct. So we want more volume in the bottom. And then also you have great nasal columns, which are these two things here. If you don't have great nasal columns, it's very odd. It looks very awkward. And
is that like the ducky look everyone's talking
correct. If you don't rebuild the anatomical borders and you don't have nasal columns, it looks strange. So we want to really put an emphasis on the lower lip, on the middle symmetrical portion of the lip, and also augment the nasal column just a little bit.
I'm ready. So we're gonna just numb me up and we'll be back momentarily. Oh, hi. This numbing looks a little interesting now. I know all you watching can make a lot of sexual jokes out there. Tone it down and relax. I have a high pain tolerance, everyone. I got my whole body tattooed. I've had 3 C-sections.
So a couple little pinches here. So I'm going to ask you just to stay forward like this. And you can just relax completely. Little pinch on 3. Curl your toes. 1, 2, 3. Little pinch. I can tell I'm in the perfect area. Vermilion border. Great. That's the first little pinch. Not terrible, right?
No.
Okay. Tell me if it hurts you.
Oh, I will.
Sorry about that. Now let me remind you, every time we inject, it's more comfortable because then you get more in.
Yeah, it's not bad at all.
I can tell I'm in the perfect place because I have the ability to lift up the needle. So I want to be at the anatomical boundary between the regular skin and mucosal skin because I want to augment the vermilion border on the mucosal side. What does that mean for you? It just means that you have a nerdy dermatologist who has done this a couple times before.
Alright. This doesn't hurt bad at all. This is nice.
Great.
It's a quick little massage.
So we're going to do a little pinch underneath here on 3. 1, 2, 3. Little pinch. Sorry about that. Perfect. Ears are uncomfortable.
Yeah, it's okay.
Little pinch right in the middle on 3. 1, 2, 3. Little pinch. I'm in the perfect place. 1, 2, 3. And we're just augmenting what Mother Nature gave you. So it makes my job very easy.
It's a little upgrade.
The word doctor is from the word doctorate, which means to teach. So I always tell people being a physician means being an educator, and that's why I love doing stuff like this because it allows me to educate the public and people who would never normally know sort of how an aesthetic dermatologist practices. This opens up me to their world and vice versa. So what we've done so far is we have augmented the vermilion border. The vermilion border of the lip is the side that demarcates the normal skin from the mucosal side. So by slightly rolling and augmenting this mucosal side, we give a really sexy, naughty pout to the lips. And of course it's exaggerated now because of the actual injection, but you can see this entire line is augmented, underneath is augmented, and the nasal column. So the hardest part is done. And the swelling that Jeffree is experiencing is 100% normal at this point. Now, we're going to go a little bit deeper with these next pinches. 1, 2, 3, little pinch. And every single dermatologist has their own way of doing lip augmentation. I really like to walk backwards and forwards and sort of inspect my work as I go along.
I think that finding a dermatologist is just like a tattoo artist. It's really important to find the right person. There are a million people nowadays injecting and doing all this stuff, but go to the right person, just like a tattoo. I've seen so many bad lips or bad with anything. So do your research, people.
Well, there's certainly a good dermatologist is going to bring you in, explain what he or she does, and then let you make the ultimate decision. And you just have to make sure that, just like anything in life, you want to be on the same page with that person.
Exactly.
So now we did the hardest job. Now we're going to do the easier pieces. Little pinch, 1, 2, 3. The swelling, we can expect it to go down considerably in the next couple hours, but over the course of the next week, we need a lot of positive swelling and resolution of the negative swelling. And then one of the other things when we do great lip augmentation is you have to remember the lips are a 3D object. They're not a 2D object. And so as a result, one of the things that I like to do, a technique I like to incorporate, is an intraoral injection. So we pull the lip down. This is a mucosal injection, little pinch, 1, 2, 3. So who has the most phenomenal lips that you can think of? Well, Angelina Jolie. Why is that? She has a really natural flare to her lips. So her teeth are flared out, and as a result, it causes her lips to flare out. And when the lips flare out, the human eye associates that with sexiness.
And since we've met, I've gotten all my teeth done. So when we first did it, my teeth were more sunken into my face, and now that they're more pushed out, I think the lips look even better.
Absolutely. And the lips are sort of like the curtains to the teeth. You know, if you think of the teeth as like a window, the curtains really augment that window. We're almost done. This is a little pinch here that hurts. 1, 2, 3.
That made my eyes water a little.
That one hurts a lot. Don't move. We're still...
Come through waterproof mascara. Woo! Okay, we're good.
So bleeding and bruising, 100% normal. You should always have some level of both. And if you're not, then the person doing the procedure is not getting to the right anatomical level. Because, you know, the lips are very vascular. There should be blood involved. You don't want to be gushing blood. But by the same token, 1, 2, 3, if you don't have a vascular component to what you're doing, then you're simply not in the right place anatomically. So we're actually done with augmentation. And now I'm just cleaning you up with a little bit of hydrogen peroxide and a little bit of alcohol. And what's really important now is what you do when you leave here. And I tell people, half of lip augmentation is what I do, and half of it is what you do when you leave here. So what do I want to do? I want to pinch here, make a little taco there like this, hold in the middle. Then I want to do intraoral manipulation of lips. So any little nodules we want to smooth out. The more you massage it, the better you're going to do.
The average person doesn't heal themselves correctly. I think with a lot of stuff, whether it's surgery or anything, they get it and they're like, all right, I'm done. It's like, you have to take care of it if you want it to look good.
100%. This is a partnership, and I don't live with you. And what you do here when you leave the clinic is up to you.
Yeah.
And we'll give you really specific instructions, but if you don't follow them, there's nothing I can do about that. So anyone getting lip augmentation needs to make sure that they're committed to the process, and they need to make sure that they have great aftercare instructions when they go home.
100%. Now, I've noticed a lot of people when they comment on someone that has done lip injections, there's so many, like, myths.
Yes.
Like, where did the Botox in the mouth rumor start? Because Botox is for, well, it's for wrinkles and it's for other things, but you don't put Botox in your mouth.
Correct. Botox is a neurotoxin, so it prevents muscle movement. And I think people just associate any injection
with Botox.
They do.
They just lump it in the same category. I'm like, that's not the right thing.
It's very, very normal that the lips are going to be dry after this just because of the amount of manipulation we did to them. We poked, we prodded, we messed with them. So this is just plain old-fashioned Vaseline. It's my favorite moisturizer for the lips after a procedure like this. And we just want to put it on there, put a nice thick coat so that it does nothing other than help with the dryness that you can expect to experience. And then also, let me remind you, what you see right now is very, very swollen and asymmetrical, and that's completely normal.
Yeah.
Any asymmetry you see, you can massage out yourself, and over the course of the next week, which is probably when you'll do this follow-up video, you'll see the final results. Some practitioners will say don't massage the juvenilar or the Restylane because it's where we want it to be.
Where it's supposed to be, right.
I disagree with that wholeheartedly. Once again, this goes back to the mantra of looking in the mirror and massaging them the way you want them to look because you have the ability to manipulate them.
Right.
So 5 minutes out of every hour for the rest of today is your job to massage them. Questions for me?
I think I'm a veteran. We've been doing this a long time, so I'm question-free today.
You're going to do great. Massage, massage, massage. Call me with any questions. I'd love to get a picture in a week and see how they look.
Perfect. Thank you so much.
Thank you.
Yes, thank you. All right, guys. I am really numbed up and swollen, so I will see you shortly.